Welcome, everybody. And thank you for being here. It's so important to us. As we begin, I'd like you to imagine yourself. I know this is hard, but imagine yourself as a healthy, active 85-year-old who's accidentally fallen and fractured your hip. You're discharged from the hospital, and after surgery, you're limited by pain and mobility problems while recovering. Now, who will be there to take care of you, to help you dress, bathe, and get your meals? Well, for most of us, that will be a family caregiver, a caregiver who will need support to support you. That's what we're talking about today. I'm Terry Fulmer, and I'm president of the John A. Hartford Foundation in New York City. We're a national, nonpartisan philanthropy, and our mission is to improve the care of older adults, which means supporting family caregivers. Our program staff has deep experience in these areas, and we're also partnered with a robust network of grantees. They produce data, create resources and training programs, and advocate for policies that promote age-friendly care. Age-friendly care means focusing on what matters most to older adults, no matter where they live or their background. It also means that the care is reliable, causes no harm, and is in line with their goals and preferences. Well, supporting family caregivers is an essential component of age-friendly care. And as a nurse, I've seen how family caregivers are the true backbone of good care, and when somebody is hospitalized or needs long-term care. And I've seen how often those caregivers are ignored or left to wonder, what do I do now? I'm pleased to welcome you to today's discussion about essential policies to better support caregivers. The president-elect discussed and committed to helping caregivers, and with a new Congress, we have the opportunity and responsibility to create a policy agenda that builds on the current momentum to provide the support that caregivers need and deserve. With that, let me introduce our moderator and our foundation's policy advisor, Bob Blancato, the president of Matz, Blancato and Associates. He serves as the national coordinator of the 3,000-member Elder Justice Coalition, and he's spent 17 years on the staff of the U.S. House Select Committee on Aging and has participated in 4 White House conferences on aging and is vice chair of the AARP board. Bob, I'll turn it over to you, and thank you.
Thank you, Dr. Fulmer, and thanks to our panelists and everyone joining us. And I have spent my career advocating for policies to better support older adults. I'm pleased to advise the John A. Hartford Foundation, which has been a driving force and North Star when it comes to improving care for older adults. I look forward to moderating today's discussion. I know it will be useful to everyone who works on policy. Before we begin our discussion, I'd like to introduce our 2 speakers. Rani Snyder is Vice President of Programs at John A. Hartford Foundation. She has more than 25 years of experience working across the health sector to improve the care of older adults and the people who support them. She leads the foundation's $25 million in annual grant making, including its family caregiving portfolio. Jason Resendez is the President and CEO of the National Alliance for Caregiving, where he leads initiatives to improve support for America's family caregivers. Jason is a nationally recognized caregiving expert and has advised federal agencies, including the National Institute on Aging, the National Academies of Medicine, and the Administration for Community Living. After Rani and Jason speak, we'll open the floor for questions. Please submit any you may have using the Zoom Q&A function, or feature, I should say. Before we discuss policy, Rani is going to tell us more about the state of caregiving in the United States. Welcome, Rani.
Thank you, Bob. We really appreciate you. Let me start by saying that the millions of spouses, partners, siblings, children, and friends who provide care to older people and also people with disabilities are really, as Terry already referenced, the backbone of care in this country. That's especially true when it comes to long-term care and helping people age in place in our communities. We hear directly from caregivers, and we have data showing that we need more support from virtually every sector. My dad is on this webinar today. Hi, Dad. And he was a caregiver for his mom for, probably almost 10 years. Personally, I'm in the midst of a caregiving journey right now for my father-in-law, I suspect many of you can relate. And I should say I'm not his primary caregiver. He has my mother-in-law, his wife, my husband and my husband's brother and his wife. And even with all of that support, it's very easy to see and frankly to feel how challenging it can be, and how life-changing it can be for any of us in that role. We also know how rewarding that can be. So we want to make sure to celebrate caregiving as much as we highlight those challenges. Caregiving is both a personal and a societal issue, and every single person, every organization has a role to play in building better systems of care to support caregivers. So as the number of older adults living in America grows, we really have to keep pace with the needs of family caregiving, since we talked about that backbone, and listen to them. And when they tell us what they need, because frankly, it's going to be what we all need. So let's start with what the current state of caregiving is in the United States. And if you would, please bring up the first slide. Okay, who are caregivers? Well, frankly, nearly all of us at some point in our lives are going to be caregivers. There are, at last count, 53 million Americans who are caregivers. And just for context, because that's a big number, let me add, that is a larger number than the entire population of the state of California, which is our most populous state. 37 million of those are caring for older people. 30% of our caregivers live in a household that also includes both either children or grandchildren, and 61% of caregivers work full or part-time jobs. So think of that coordination, not even just the care coordination, but life coordination. 69% of those report having to rearrange their work schedule or take unpaid leave. And not surprisingly, nearly 60% of caregivers are women, and 41 fit into that age bracket, that 45 to 64 years old, which is the sandwich generation kind of age and stage. So if you go to the next slide, I want to talk about why caregivers need more support. Well, frankly, we can't afford not to support family caregivers. Family caregivers provide an estimated $600 billion, that's with a B, $1 billion worth of care, and pay more than $7,200 in care-related out-of-pockets on average themselves. So they're also paying for this role. Shifting to paid caregivers, the direct care workforce, would place quite a toll on federal and state budgets, something we think about a lot. And right now, we really don't have the workforce to provide paid care for every caregiver who needs it regardless. And that's why our healthcare system and our long-term care systems really require, all of us require, family caregivers in order to be able to function. Next slide, please. So I want to talk about how we can support family caregivers. Well, we've got what we call a roadmap with the National Strategy to Support Family Caregivers, created under the leadership of the Federal Administration for Community Living. It was developed in 2022 following congressional passage of the Raise Family Caregivers Act. This was an act that was signed into law under the first Trump administration and carried out more recently, so it's truly bipartisan. It outlines the 350 actions that 15 different federal agencies committed to take using existing funding and programs in the most efficient ways possible. I want to note that 350 actions and that 15 different federal agencies, both of those two numbers have grown since then. So there's a little bit of momentum here. The strategy also outlines actions that states, local communities, philanthropies like us, employers, and really every single sector should take in order to better support caregivers. So we have a grantee, the National Academy for State Health Policy, known as NASHP, that produced action guides for different sectors that can be found at supportcaregiving.org. And both the Administration for Community Living, the federal agency, and NASHP have recently released reports this year. Those two reports offer really valuable information on how we should move forward next. So I'm about to turn it back to Bob, but before I do that, let me just note that our foundation, the John A. Hartford Foundation, does not lobby for or against, endorse, or oppose any legislation. What we do, we and our grantees, is to educate policy members about important issues that matter deeply to the people they represent. Thank you.
Thank you, Rani. You know, it is important for legislators and regulators to remember that family caregiving is not just a healthcare issue, it's an economic issue. If the United States does not do more to support family caregivers, healthcare costs will skyrocket. Caregivers leaving the workforce to fulfill their responsibilities could take a devastating economic toll. Now we're going to share a brief video featuring family caregivers talking about their experiences and the challenges they face. You know, it's easy, especially in Washington, to get lost in policy specifics. And it's essential that we remember how caregiving policies affect real people every day. Please, the slide, video.
Our culture, at least in my family, is that we care for folks at home. And that's hard.
Growing up, you're around different family members that take care of family members as they age, and you don't normally put a formal title to that, but it's something families do for other family members as they age.
In our culture too, the biggest thing is we just don't put them in a nursing home. We all support, family comes in and we help mom and dad do what they wanted to do.
What drives you crazy is the specialization. So the neurologist is telling me one thing and the psychiatrist is telling me something else, and I'm like, I'm not an MD, and you people don't talk to each other.
I'm physically tired. Sometimes I get overwhelmed. Probably about 3 months ago, I started to get sick from stress, and it wasn't until my doctors said you're dehydrated and you have a high level of stress that I realized the toll that it was taking upon my body.
A very powerful video. During the 2024 presidential election, President-elect Trump vowed to increase federal support for family caregivers. He talked about the importance of home care for older adults and called for a caregiver tax credit, though he did not include specifics. Jason, what specific policy action is most important and feasible? I'll challenge you to briefly provide an overview of 4 or 5 areas, and then we can discuss further with our audience. Welcome, my friend.
Thanks so much, Bob, and thanks, Rani, and to the Hartford Foundation for having me. Those videos and the data that Rani shared are a powerful reminder that caregiving touches all of us. And I think that same reminder was made clear when both presidential candidates were talking about the importance of advancing care policies. And whether you're providing 24/7 care for an aging parent with Alzheimer's, helping a child with special healthcare needs, or supporting a spouse through chronic illness, caregiving transcends politics and connects all of us through our shared humanity. And so I want to highlight several bipartisan opportunities to strengthen support for this vital community. These solutions emerge from an unprecedented collaboration through efforts like the Act on Race campaign, which unites over 120 organizations across aging, disability, and patient advocacy to advance the goals of the national strategy to support family caregivers. And we're grateful to the support of the Hartford Foundation of this essential work. From the reauthorization of the Older Americans Act to expanding respite care access and providing tax relief for working caregivers, we have clear opportunities to turn caregivers' stories into meaningful action. These policy solutions reflect our shared commitment to supporting the millions of Americans who make daily sacrifices for their loved ones. And I'll highlight a couple of pieces of bipartisan legislation that are supported by the National Alliance for Caregiving. Next slide. Oh, let's leave it here, actually. Go slide back. I'll start with the Older Americans Act. The National Alliance for Caregiving strongly supports S4776, the Older Americans Act reauthorization of 2024. For nearly 6 decades, we'll celebrate the 60th anniversary of the Older Americans Act next year. It's been a foundational policy in helping older adults and their family caregivers age in their homes with dignity. Serving nearly 12 million people annually, it provides comprehensive support through multiple programs. The National Family Caregiver Support Program delivers essential services, including respite, training, counseling, and assistance for family caregivers in accessing support. Title IIIB funds critical services like transportation, home care, and adult care for aging adults. And for tribal communities, Title VI provides culturally appropriate caregiver support services. Now, we must continue to strengthen these programs as our nation ages and more responsibility is put on the shoulders of family caregivers. S4776 extends vital program funding through 2029, strengthens caregiver assessment and support, and reauthorizes both the Raise Family Caregivers Act and Supporting Grandparents Raising Grandchildren's Act. Given that the National Family Caregiver Support Program currently reaches only a fraction of eligible caregivers, the reauthorization includes modest increases in authorized funding to continue to reach more and more families. Through these programs, this reauthorization offers Congress a crucial opportunity to strengthen support for family caregivers in every community. This bill's bipartisan nature demonstrates that supporting caregivers transcends politics. It's about helping millions of Americans who care for their loved ones daily. Next slide. Now, let me turn to another critical piece of legislation, the Lifespan Respite Care Program Reauthorization Act, or S4325. The Lifespan Respite Care Program addresses a critical gap in family caregiving support. While respite care provides essential relief for family caregivers, being able to take time to care for themselves, to attend to essential tasks like medical care or just having the time to rest, 86% of family caregivers have never accessed respite services. This leads to increased stress and isolation for family caregivers. This bipartisan legislation, championed by Senators Collins and Baldwin, would extend the program through 2029 with $50 million in funding over 5 years. Notably, the Senate version expands eligibility to include youth caregivers under 18, a significant change that would support over 5 million people under the age of 18 who are caring for older adults, parents, military family members, or siblings with disabilities, while maintaining their educational pathways. This program's impact is already evident through competitive grants at 38 states and DC, providing planned and emergency respite services, person-centered care, and affordable access for underserved communities. These services advance key goals of the national strategy to support family caregivers while delivering economic benefits. By delaying nursing home placement, respite care can save tens of thousands in Medicaid and private insurance costs per individual. Advancing this common sense legislation is vital for strengthening America's caregiving infrastructure and advancing the goals of the national strategy to support family caregivers. Next slide. And we can't talk about supporting family caregivers without addressing the economic impacts of care on working families. The financial strain on family caregivers is staggering. Nearly half report significant negative financial impacts from mounting debt to depleting savings. This reality drives goal 4 of the national strategy to support family caregivers, of ensuring financial and workplace security through targeted policies. To address this challenge, NAC strongly supports the Credit for Caring Act. This bipartisan legislation would create a federal tax credit up to $5,000 for eligible working family caregivers. The economic rationale is compelling. In 2021, family caregiving for adults was valued around $600 billion, as Rani outlined, surpassing all out-of-pocket healthcare spending in the US. Meanwhile, businesses lose up to $33 billion annually in productivity costs as employees struggle to balance both work and care. The proposed tax credit is thoughtfully designed with several key features, including a non-refundable credit up to $5,000, eligibility for caregivers of individuals with functional or cognitive limitations, and qualification whether caregivers live with the care recipient or not, and support for maintaining both employment and caregiving duties. This legislation fills a critical gap by supporting working caregivers who provide essential family care while remaining in the workforce. The tax relief helps caregivers maintain their dual roles, which benefits families while reducing both business costs and potential institutionalization expenses. Passing the Credit for Caring Act would recognize the vital economic contributions of working family caregivers and provide financial support to millions of Americans who are balancing the demands of providing care and affording that care. Next slide. Finally, I want to highlight important changes in how our healthcare system supports family caregivers. The Centers for Medicare and Medicaid Services is taking historic steps through the physician fee schedule to engage and train family caregivers. These reforms complement the Older Americans Act support system and the Credit for Caring Act's financial relief by expanding payment for caregiver training services delivered by healthcare professionals, improving telehealth access for rural communities, and strengthening behavioral health support. These changes address a critical gap. While nearly 60% of family caregivers are navigating complex medical and nursing tasks, just around 29% have ever had a conversation with their healthcare providers about their caregiving responsibilities. So there's a gap between the roles that family caregivers are playing in supporting their family members and the support that they get from the healthcare system in carrying out those roles. Now, by creating new incentives to identify and train family caregivers, Medicare is sending a strong signal about the value of more formally integrating family caregivers into healthcare teams, a goal outlined in the National Strategy to Support Family Caregivers. Equally important is expanding Medicaid funding for home and community-based services. This investment would allow states to offer more consumer-directed care options, resulting in enhanced home-based care support, greater flexibility in care delivery, improved respite service access, stronger aging-in-place support, and reduced institutional care dependence. These Medicare and Medicaid reforms recognize caregivers as essential healthcare partners, completing a comprehensive support system alongside Older Americans Act reauthorization and caregiver tax credits. Together, these incentives strengthen support for America's 53 million family caregivers who are navigating complex care while sustaining our nation's economy and healthcare system. And these are only a few of the opportunities that we have to advance a comprehensive system of support for family caregivers aligned with the national strategy. But it's an important start in moving us towards a future where family caregivers are recognized and valued. And the fact that these are bipartisan solutions acknowledges that care connects all of us, and there are opportunities for all of us to advance support for family caregivers because care really is our common ground. Back to you, Bob.
Thank you, Jason. Thank you very much for those insights. You know, it's great that caregivers from across the country just gathered right here in Washington, D.C. to advocate for the kinds of support that you just discussed. And based on your remarks, while we have an urgent need, there are already solutions on the table. The National Strategy to Support Family Caregivers was a major commitment to an all-of-government approach to help caregivers. There's so much momentum right now, which is a great thing. Now, we're now going to turn to questions. If you'd like to submit a question, please do so by using the Q&A function. Happy to say we have a lot of questions already, which is great, but I get the prerogative as the moderator to ask the first question. Are there any CMS program changes that you'd like to see to support family caregivers? I'll start with Rani first.
Great. Thanks, Bob. We know that there are already some really exciting new CMS codes to pay caregivers, to pay providers for caregiver training and support. So we really applaud CMS and what they have done thus far. And yeah, there's always more that can and quite frankly should be done. We think that we need more outreach to providers so that they will be and remain aware that Medicare will pay for caregiving related services, so that they will consider offering this kind of training. And I'll add one other example from some of our work. There's a great program at Rush Medical Center. It's called Caring for Caregivers. And it provides evidence-based, age-friendly healthcare to older caregivers who are bringing their spouse or other relative to appointments. And that program's early data is showing positive health outcomes for both caregivers and care recipients. It reduces depression and stress. It allows for fewer inpatient days and ER visits. So those are just the kinds of examples that we are seeking and doing everything we can to reinforce.
Jason?
Yeah, and I would double down, right? It's great that we have new reimbursement pathways to train family caregivers to address, better equip them to provide quality care. But those reimbursement pathways are only going to turn into meaningful change if we do more to incentivize and engage providers and systems to utilize those pathways. Second, we would like to see CMS do more to integrate caregivers into quality-based assessments of care that's being delivered. And so new quality measures that take into consideration the impact of care. And we've seen some great moves from CMS to integrate age-friendly approaches into quality assessment. I think caregiver viewpoints is an extension and can build on that positive momentum. I think there's more that we can do to integrate family caregivers into the in-home healthcare benefit. One of the things that we see that's a really positive aspect of the Medicaid program is the ability to integrate caregivers and pay caregivers for providing care. This is something that we see limited opportunities to do through Medicare, but something that we could do more to innovate and to expand, given the direct care workforce shortage that we're in. We need to do more to think about how we invest directly in family caregivers, in addition to investing in the providers that train family caregivers.
Thank you, Ronnie and Jason. So our next question comes from the audience, where we like to see questions come. And Teresa Sweeney, thank you for asking the question. What exactly does the Respite Care Act cover? Jason, I'll start with you.
Yeah, the Respite Act covers a number of things, really helping states to establish these programs and provide funding to states. It also does, with this, the Senate version, incorporates new guidance around eligibility of who is able to access respite services through the respite care program. And right now, we are limiting access to that respite, not recognizing important parts of the population who are supporting older adults and people navigating complex care, including folks under the age of 18. So it expand coverage for those individuals.
Rani, anything you want to add?
Only that some of the existing respite funding, which is minimal, quite frankly, but so critical, does fund, in addition to some of the kinds of things that Jason has referenced and respite services in each state, some research so that we can better understand the ways to deploy respite that are most useful for all of our communities, and that research ultimately can feed future services. That's what we need in order to allow our caregivers to thrive in community.
Thank you. Here's another question from the audience. We know that many more recent immigrant communities have an extended family approach to support, while also tapped to join the health at home workforce for low hourly wage. What do you think we can do to ensure family, however defined, is part of the future? Ronnie, I'll start with you this one.
Well, I would start with something Jason already referenced, which is the self-directed care that's happening in many of our communities. Just for anyone who's unfamiliar with what that is, it's mostly funded through Medicare, but there are some other programs in other states where there are programs for caregivers to be chosen essentially by the person they're caring for, and then paid a modest amount for that care. It helps to support the overall family system, and it frankly gives jobs that ultimately we would love for those individuals, when they are not family caregivers, to be able to get into the market and provide a service where we already have a severe shortage of direct care workers nationally.
Jason?
Yeah, I think one of the critical things that we need to continuously do as a field, as policymakers, as decision makers within health systems, is continue to reevaluate how we define what a family caregiver is. And I think that's important as we think about the millions of LGBT caregivers who are providing care for chosen family, friends and neighbors. As we think about how policy is designed, FMLA is a great example, where in some states, you're not able to take advantage of FMLA because you're providing care for an aunt. We've seen several advocates who fall into that category. So thinking about how we define family caregiving and build policy around a broader definition, like the definition found in the national strategy, can help us recognize the intergenerational family structures that are being referenced in the question, and support more individuals who are taking on the role of family caregiver.
There's a lot of excitement about the Credit for Caring Act, which would be historic, obviously, if it were to pass. So what is the status right now of the Credit for Caring Act, Jason?
I think the status is like a lot of things. We're seeing what's going to move over the next couple, 2 weeks. But I think it has strong bipartisan support, bicameral support, having President-elect Trump talk about the importance of specifically a tax credit for caregivers moves that conversation along. We also know no matter what happens over the next 2 weeks, there is going to be a tax debate in the next Congress. And so that creates opportunities for continuing this conversation and keeping caregivers front in mind in the conversation around what the future of the Trump tax cuts look like.
Before I turn to Ronnie, Terry, is there something you wanted to add? I see you.
Well, you know, as I listen, and this is such a active and proactive conversation about what we can do in Washington. I think that just reminding this group that aging is a bipartisan issue, that we have great actions in place that everybody should be pushing, like the new guide model for dementia care that helps family caregivers, the new age-friendly hospital measure that helps every older adult and their family during that hospitalization and after. So I just urge everybody who's listening today to use what's out there. Ask us on this screen if you need something. You know, as we say, never worry alone. We really have content that we want to drive for you, with you, and for the purpose of all your communities. Back to you, Bob.
Thank you, Terry. Ronnie, anything you want to add?
No, I think Jason covered it with regard to the.
Well, you keep the questions coming, folks. You're doing a good job. We have another great question. What could we consider to increase access to support for family caregivers in rural America, which obviously is a huge area right now? Jason?
Yeah, I think there's a number of elements, and I think some where we're making progress. So I'll take the example that we've talked about, the caregiver training service reimbursement codes, which were introduced as part of the Medicare physician fee schedule for 2024. Those initially had to be in-person trainings. When if you're living in a rural community, that might be a lot harder because of inadequate access to care, particularly specialty care. Within rural settings. And so advocates like the National Alliance for Caregiving and others through the Act on Raise campaign and beyond really championed the expansion of those caregiver training service codes to be able to be delivered through telehealth. And I'm happy to report that as part of the finalized 2025 physician fee schedule, those will be able to be delivered provisionally through telehealth, which is an important advancement for rural Americans, but then also for just working caregivers, right, who are balancing care and work. We know over 60% of family caregivers are providing care while working, who might not be able to make an in-person training. So telehealth becomes a really critical element. At the same time, that's provisional, right? CMS needs congressional action in order to make permanent the telehealth flexibilities that were established during the pandemic. So continuing to invest in telehealth, I think, is critical, but also ensuring that we are evaluating the effectiveness, the impact, and the equity of that telehealth delivery is going to be important as we think about better supporting rural Americans.
Ronnie?
Well, I love that Jason referenced telehealth because we feel really strongly that these are the kinds of tools that will benefit people nationally and certainly in rural areas. So I have two kind of specific examples. So one of those is the program of hospital at home, where where for certain conditions, people can be seen in their home with full interdisciplinary team. That the hospital home programs nationally are working very hard to be able to address rural concerns. And then the second example that I will reference is as a state example. So North Dakota, where 50% of the population is rural, is currently helping people to age in place by allowing spouses and other family members to receive Medicaid payment for providing care. That's some of the sort of self-direction kind of work that was referenced. And the piece that's sort of a twist on that is that the state Medicaid program also pays a higher rate to aides who are willing to travel to provide those services in rural areas. So these programs do exist, and there are ways that we could look at capitalizing and spreading those.
Thank you. Again, from our audience, Jason, you talked about CMS caregiver support. Can you or Ronnie also talk about the Medicare guide model a little bit, which Terry just mentioned? Either one?
Yeah, I'm going to turn over to the experts here, but we're really excited about guide. I think GUIDE sets a really important precedent that looks at the family caregiver as an essential component of a care team in the same way that CTS does, but GUIDE is unique in that it's really 360 support. And it's an area where we would love to see, depending on what this data looks like over the next 8 years, see expanded to other complex care areas, given the important investments that GUIDE is making in family caregiver health, wellness, 360 care, which I'm sure Rani could talk more about.
Yeah, we're super excited too. Thank you, Jason. And thanks for that question, Bob, and to our audience. So we've worked really hard together with a variety of partners and experts in dementia care to help set up the possibility of this new demonstration model, which is what the GUIDE program is. It is the first ever comprehensive payment model for dementia care. And let me tell you what I mean by comprehensive. So that includes the clinical care side of dementia care and very specific supports for caregivers, which is the topic of this webinar. So in addition to the support for caregivers in the GUIDE model, or part of some of those supports, which are community supports, includes respite care as well, which we've already referenced. So we're working hard right now. First of all, just all accolades to CMS for starting this work, because it's something that our nation so desperately needs. And we're working to support some of the evidence-based programs that exist that meet all of the GUIDE criteria, because being able to offer these services that are both clinical, that start with the diagnosis, bring one through the arc that is dementia care for most people, and include caregiving and supports and respite services is not always easy to stand up. But we want very much for this, as Jason referenced, 8-year demonstration to show sufficient success based on those evidence-based programs that we already know work, so that it can become a permanent model, and so that it can be brought out beyond what it currently is, which is strictly fee-for-service, and moved over to also value-based payment. So value-based payment has been growing for years. As we know, Medicare Advantage is over 50% now of the enrolled Medicare population. And what we want and need is to see this move broadly, so that all of our communities, wherever you are, you can receive those services, and that they genuinely help both the patients and the family caregivers.
Great. We're coming down to the last couple of questions, but one from the audience that just came that said, how does the incoming administration's proposal to cut Medicaid funds impact the home and community-based services infrastructure? Jason?
Yeah, I think that's an area that we're very concerned about, right? Medicaid is the primary payer for long-term care in this country. Home and community-based services are essential to supporting the work of family care, to supporting older adults as they age, for supporting individuals navigating complex and serious illnesses. So we have to do as much as we can to protect Medicaid and to preserve Medicaid in supporting family caregivers. One of the great examples that we've talked about is consumer direction, right? Consumer direction really essential to addressing the direct care workforce shortage that we have in this country, to recognizing the economic contributions of family caregivers. There are already a lot of barriers to family caregivers accessing consumer direction. So cuts to Medicaid funding could impact those kinds of programs and then reduce care overall. So I think we need to look at, states that have done a really good job being good stewards of those Medicaid dollars and use them as examples of how we can continue to invest and provide states with the flexibilities that they need to support older adults and their caregivers as they age and as they navigate complex medical and serious illnesses.
And Bob, I do want
Terry?
to jump in. Yeah,
Yes,
thank
Terry.
you. And what does this mean? It means that our emergency rooms, which are already overflowing, will quadruple in the number of older adults who use that as a first point of service when their caregivers are overwhelmed. So this moment where Medicaid changes could potentially take place means that you can expect you will not be able to get your surgery done because you will not have a hospital bed. Please understand, this is a system-wide devastating action. Back to you, Bob.
Okay, Rani, anything before I go to the next question?
Just to say that, well, two things. First of all, I think in the coming years, we're going to see more and more movement towards states and state action, and less to some of the federal action. So Jason's point about looking to where there are really good examples is a great jumping off point for this work. And that a lot of the services and supports that can be added in that context will be incremental. We at our foundation work really hard to sort of press on an issue from all angles to figure out every way that we can build supports. And it's not strictly one or another, but we do see the trend in supporting home and community-based services more and more from and within states in hopes to move away from some of the nursing home care, which has also been really controversial.
Great. I'm told we have time for a couple more questions. One that's come in from Jonathan Berger. Thank you for the question. Why is there no national standard for caregivers? There are no standards and guidelines to become a caregiver. Who wants that one first? Terry, since you're still on, you want to take that?
I'm going to start and then give it to the people who really know. But here's what I'm going to say. Why are there no standards for care for older adults in this country, no matter where they get care, so that caregivers can get that support? That's why we're asking you to join the Age-Friendly Health System Initiative, which is global, and to make sure that people get reliable, evidence-based, goal-directed care. Jason, what would you add?
Yeah, I'd say that we need, I think we need to think about caregivers, sort of direct care workers, which are referred to as caregivers often, and then family caregivers, right? We just have to keep in mind the definitions of how we think about the care continuum and the care ecosystem. From a family caregiver perspective, we think there should be standards. We think around training. What are standards look like for the kinds of training that CMS will start to reimburse for, right? We have to make sure that that training, if providers are going to be reimbursed for it, need to be quality, equitable, culturally sensitive, effective training. So standards are really important, and that's where quality measures, the age-friendly measures are important and serve as a model to think about how do we approach that from a caregiver perspective and how systems are engaging and supporting family caregivers. So training and quality and standards are really important. At the same time, we have to make sure that they reflect the lived realities and experiences and conditions of family caregiving, because caregiving touches all of us, and yet caregiving doesn't look like the same thing, right? With your care providing dementia care, you're providing cancer care, rare disease care, there might be some common elements, but there's also a lot of differentiation between those kinds of care situations, and so we have to keep that in mind as we think about training and standards.
Excellent. Rani, anything to add?
I'm glad that Jason referenced training, because many of the programs that rely on self-directed care actually via the states will have their own training and requirements, and therefore some of those are standards. But the other thing is that caregiving is so multi-sectoral. I mean, you're not just caregiving when it comes to healthcare. You're not just caregiving when it comes to, what a state will fund. Caregiving is so broad. It includes, what a lot of our home and community-based, our community-based organizations are doing. We're talking about meals and shopping, in addition to the more medicalized components of caregiving. And there is not a single standard, but that does not mean that many of these programs don't have their own training and standards for the variety of services that exist.
The next question is the kind I like to see come from a webinar like this. And it comes from two people, Kendra Schmidt, thank you, and Mary Lynn Guarino. Are there ways we can be involved in family caregiver support at the local and state levels? And I'm a provider in Florida. How do I find out all the services that are available in my state? So let's go with the first one. How do you get more involved at the state and local level? Jason, I think I'll start with you.
Yeah, I think there's lots of different opportunities to get involved at the local and state level. One is as part of the a first update to the Older Americans Act regulations and rules since the National Family Caregiver Support Program was put into place now requires family caregiver representation on the boards of local area agencies on aging. So I'd say reach out to your local area agency on aging. There's volunteer opportunities, there's governance opportunities now that are part of that program. So there's, I think, lots of rich pathways there. Second is, I would be remiss as the kind of resident advocate on this Zoom to say that, as you think about making decisions on who you're going to vote for, ask about their stances on care policy, on things like paid family and medical leave, on things like caregiver tax credits at the state and national level, on in-home health through Medicare, where they stand in protecting Medicaid and supporting Medicaid, and become a care voter, right? That's, again, bipartisan, falls on both sides of the aisle, but that's a one way to think about your contributions to supporting family caregivers that comes around, on a regular basis.
Great.
I would be
Okay.
remiss, Bob, if I didn't
Yes, Rani.
start by saying that the John A. Hartford Foundation puts out a lot of communications and references, resources. Some of them are already in your chat. But we would be happy to be the link to any of the resources that exist. We also are constantly looking for new ways to support within communities. I'll note that the funding that we have given in conjunction with the Federal Administration for Community Living to the organization I referenced when I spoke a little bit earlier, NASHP, we've come together, we've designed a new website. It's called supportcaregiving.org. It's in the chat. You've now got the John A. Hartford Foundation website in the chat as well. And our whole mission is to assist people in communities to improve the care of older adults. So call on us anywhere possible. Jason referenced community-based organizations, and we work with an organization called US Aging. And they are the national organization for all of those AAAs, as they're called, area agencies on aging, and the community-based organizations in community that do much of this work. And not only does US Aging have as one of its primary goals the support of caregivers in its most recent strategy, but they also run something funded by the Administration for Community Living called Elder Care Locator. It's not the answer to everyone's questions all the time, but it's a good place to start when you're looking for resources in a community and want to know what organizations provide that kind of care. So if you're looking for how, where are the organizations where I might ask some of the questions that Jason referenced, that's one of the places I would start.
That's great. Thank you. So our last question, and I'm sorry I have to tell you, you have to give me a brief answer on this one. What one program or type of support do you think has the best chance of advancing in 2025? Jason.
Well, I think I'll just kind of take the safest bet because it's the only caregiver-specific thing that President-elect Trump has talked about, which is caregiver tax credits. I think that has one of the best shots. And I don't say the Older Americans Act because I'm confident the Older Americans Act will happen before the next Congress. That's my hope, and I have all my candles lit. You can't see them; they're under my desk.
Don't light any fires. Well, actually, Jason 100% stole my thunder because I was going to say I totally agree. We think that caregiving tax credits have the best chance of advancing given Trump's campaign. And since Jason said that first, I was going to also say it looks likely that the Older Americans Act may be moved this year. So that wouldn't even be 2025. But this is a fact we all know, but we haven't stated explicitly, the RAISE caregiving work is now embedded in the new Older Americans Act. So it's critical that we be able to move that this year in order to support caregivers.
And since you were so good being brief, Terry, I'm going to ask you for your thought on that one.
Thank you. I think that both Jason and Rani have really underscored what we think will move, and it's up to all of us to tell the stories. And I started by saying, if you broke your hip, if your mother, if your grandmother, if your grandfather, so keep thinking about what we need to just support family caregivers.